And I love, love, love the way Jeremy ended his presentation by asking us questions. Who should be incarcerated? Should anyone be incarcerated? If you decide to incarcerate someone, how long should they be incarcerated? What resources will we give a person who's incarcerated? What resources will we give people before they are incarcerated? Those are the questions that will shape our next 25 years. You have before you now, for phase 2 of our celebration of criminal justice policy, past, present, and future, an amazing panel. Now, I'm only going to introduce our moderator. Our moderator is Professor Angela Jordan Davis. I usually just say Angela Davis and have people's heads snap, you know. And they go, where is she? You know, I say it all the time, like, well, what are you doing? Oh, I was just on the phone with my girlfriend, Angela Davis. You know Angela Davis? Why, yes, I do. She and I are tight. You know? But see, my Angela Davis is even better than the one y'all thinking about. My Angela Davis is a professor at the Washington College of Law, which is American University's law school. You can read her bio. We put bios of all the panelists in your materials, and yes, you are welcome to read those things. What this written paragraph will not tell you about Angela, it will tell you about what I think is an absolutely brilliant, brilliant book that she wrote. I cannot solicit funds, it's inappropriate, but I can tell you that you should buy Angela's book. Sincerely, okay? You should. It really is. Her book, Arbitrary Justice, is just an amazing book. It examines prosecutorial discretion and its impact on the justice system. It is a wonderful book. She is the perfect moderator for this panel. And what I wanted to share with you in all seriousness is that what this brief bio does not tell you about Angela is that she is passionate. She is committed. She is relentless in her pursuit of all that is fair and right. Just a boundless source of creativity. I cannot tell you more wonderful things about her. She writes the way I like things written, clean and crisp. And she talks the way I like to talk, fast and quick. You know, you will really enjoy a lively, lively panel discussion today of the issues that have been laid before you. So please welcome warmly Professor Angela Davis.
Thank you, Judge Hughes. Is the microphone? Can you guys hear me? Yes. Okay. Excellent. Thank you so much for that way too generous introduction. And welcome to our panel discussion this afternoon that I'm sure you're going to find informative and very, very interesting. I want to start out by introducing very briefly the panelists. Please do look at the bios in your packets to get a bigger picture of what these wonderful, incredible people are doing and have done in their lives. We don't have time to introduce them fully, so I'm just going to introduce them very briefly, left to right, and then I'm going to tell you a little bit about our panel and what we're going to be doing this afternoon. So to your far left, in where he's sitting only, and not his political leanings, is Grover Norquist, who is the president and founder of Americans for Tax Reform. He works on criminal justice reform among conservative policymakers and lawmakers. Next is Dr. Deborah Prothrow-Stith, who is a consultant at Spencer Stuart and a former associate dean and a professor of public health practice at Harvard School of Public Health. Next to her is Glenn Martin, who's vice president for Development and Public Affairs at the Fortune Society, as well as director of the David Rothenberg Center for Public Policy, and he works on a number of reentry programs and works with a number of reentry organizations. Next to him is Charles Joe Hynes, who's a district attorney of Kings County, and you just saw him and his magnificent program, Drug Treatment Alternatives to Prison, on the film that you saw earlier. Next to Joe is Bart Lubow, who is director of the Juvenile Justice Strategy Group at the Annie E. Casey Foundation. He works on a number of juvenile justice reform efforts and is a former social worker with New York Legal Aid's Criminal Defense Division. And last but not least is Kathleen Falk, who is the former county executive of Dane County, Wisconsin. She was the chief elected official of the second largest county in Wisconsin, and she worked on a number of smart on crime strategies when she was there. Please join me in welcoming our panel. Now, what we're going to do is, this afternoon, is we're going to start our panel with a hypothetical that is in your packet. So I'm going to ask you to look in your packets and follow along with me as I describe this hypothetical. But we're going to spend the first 15 minutes or so with the panelists role-playing, and it's going to be easy for them because they're going to be playing roles that are remarkably like the roles that they're playing in their current lives. But this is the hypothetical. State Senator Davis is the chair of the Judiciary Committee in the Grace State Legislature. Grace is the state. The state of Grace is facing many challenges in its criminal justice system. The jails and prisons are at capacity, and many of them are at risk of violating a court-ordered cap to reduce overcrowding. Although the African American and Latino population in the state is only about 25%, about 70% of the prison population is African American or Latino. About half the prison population has been convicted of nonviolent drug or property crimes, and about half convicted of violent offenses. Senator Davis is seeking solutions to the overcrowding problem that are not costly in light of the fact that the legislature will certainly have to approve severe across-the-board budget cuts. She is open to initiatives that involve alternatives to pretrial detention and incarceration, but she's very concerned about public safety. Senator Davis's constituents are concerned about crime, and she wants to be reelected. So she's invited a number of state officials and experts to a meeting to discuss this problem and provide advice. And here are the people that she's invited. She's invited Kathleen Falk, who's a county executive, Joe Hynes, the district attorney, Bart Lubow, who's an Alternatives to Incarceration funder today, Glenn Martin, who's going to be a policy advocate, Grover Norquist, who's going to be a taxpayer advocate and leader, and Dr. Deborah Prothrow-Stith, who is a public health official. And we're going to have this hypo. After we go through it for a bit, I'm then going to open the panel up for a more traditional type of discussion of these issues, leaving time at the end for questions from you. So, I'm Senator Davis, if you all hadn't guessed that. So I just want to say thank you to all of you all for accepting my invitation on such short notice and coming to this meeting. As you know from my invitation, I'm faced with a lot of tough problems. I get lots of calls from my constituents about crime problems. I don't get too many calls about people concerned about incarcerated people. But I'm also facing these budget cuts, and we just can't keep building more prisons. So I'm looking for some alternatives, but I'm going to be honest with you. I mean, I've been a state senator for 4 years. I would like to keep my job. So I do have that concern, but frankly, it's not just about keeping my job. I represent my constituents, and the constituents who are calling me and emailing me and writing me are saying, keep my neighborhood safe. They're not saying, you know, I feel bad about people who are locked up. I get a few of those, but I don't get a lot of those. So I got a problem here, and each of you have some expertise, and so I need your help. So I want to start the discussion off. First of all, I guess the first thing I need to do is talk to you, Mr. Hynes, because, you know, you're the prosecutor and you run everything. So, I mean, if you're going to be against me on this, we might as well end the meeting now. I mean, are you at least open to talking about alternatives?
Oh, absolutely.
Okay.
Absolutely. And I understand this, that the state of grace is really Brooklyn, New York in 1990. And that's what I inherited in 1990. It had become the 5th most violent municipality per capita in the United States of America. And in 2003, Money Magazine said we were one of the 10 best places to live. Now, that didn't happen because we kept, increasing warehouses of despair, as I call them, That didn't happen because we believed there was the only way to deal with the crime problem was a prison one. It was a failed strategy. You can't build your way to public safety. So we had to look at some of the options.
Well, but I'm going to stop you right there
Sure.
because I want to hear in detail about
Sure.
what you did in Brooklyn. But I just want to, you know, before you became the district attorney here. But, and that's, I'm sure, one of the reasons why you came here is to implement some of those programs, which you haven't done yet. But I want to talk to you about that in detail in a minute. The first thing I want to talk about, though, is if we're talking about alternatives to incarceration, if you remember what I said in my letter, I mean, we've got people locked up that are not just locked up on minor drug offenses, but there are a lot of people who are locked up on some violent offenses as well. So I guess my first question is, if we're talking about alternatives, should we automatically exclude any types of crimes from an alternative type program?
Yeah, of course. In the state of grace, when I'm district attorney, if you use a knife, a gun, or a bludgeon against one of my citizens, I don't want to hear about your early bedwetting. You're going to jail.
Okay, well, let me stop you right there and
Sure.
find out if the rest of you agree with him on that. Do we want to be open at least to someone? Because I understand, I don't know much about this, but you know,
Right.
I know some public defenders, and what they tell me is that a lot of times, you know, people who get charged with and even convicted of some of these offenses may not themselves have actually held a gun or a knife.
That's
in
a
their
fact.
hand.
That's a fact-driven question. And obviously, if there was a terrible example that the judge spoke about with the little kid standing in the doorway showing his gun, he may have had to do some time for that crime, but he certainly would have been locked up for a significant period of time. Certainly, the story of that young woman who talked about her brother getting life without parole. On those facts, in the state of grace, he would not have gone to jail for life without the
Well,
possibility
let me hear
of
from
parole.
some of our other meeting people. Anybody else have any thoughts on that particular question? Should we automatically, we're talking about alternatives, should we have a category of crime or crimes that we automatically exclude, regardless of the circumstances of the case, regardless of we're talking about
I just
accomplice or
want to
whatever?
finish. May I finish 1 second?
Yeah,
Okay.
sure.
Well, it'd be jail. The question of time would be a much more important issue to me. Okay? Good.
Fair enough.
Good.
Dr. Prothrow-Stith?
Well, I think developmentally, children and adolescents deserve special consideration, and obviously we have a system designed to do that. I worry that it has been much more similar to the adult system in these crimes, and a lot of teenagers get caught up into situations, and I'm reminded of a young man that Tracy Lithcott, an outreach worker for us, visited, and when he went in the house, the young man's mother was smoking crack, and Tracy said, "I'm here to see James," and she said, "Oh, he's in the back." He went to the back, and the mother made no attempt to hide that she was smoking crack. And then when Tracy left, the mother was performing a sexual favor for the man. Again, no attempt to hide what was going on. And James was accused of killing a drug dealer. And at 16, it's hard for us to appreciate what drugs did to his life. And I do think that those situations deserve that kind of individual attention, and that children and adolescents in particular might be exempt from that kind of situation.
Mr. Lubow, I'm assuming you agree with that, or
Well,
not?
I certainly agree with the professor's perspective about kids being different than adults. And therefore, in the case of juveniles, I would strongly encourage that we not have mandatory sentences and that we are, in fact, able to consider individual circumstances. I think in the larger state of grace, I'm not sure whether or not the ends that you raise, Senator, are best served by starting this debate by focusing on a small minority of cases, and especially by focusing on whether or not they're going to be eligible for a limited number of what I assume are some forms of alternative programmatic sanctions or services. The fact of the matter is, if the district attorney's perspective were to gain sway and we simply re-examined the scale of punishment that we imposed on people who right now are sort of off the radar regarding alternative sentences, that would be a huge improvement in our sentencing structure, and it would avoid the pitfalls of focusing on a small minority of cases to the detriment of the more average run-of-the-mill cases that we're now routinely locking
So
up.
you're saying instead of alternatives, we should be looking to shortening the sentences of those who are already incarcerated?
I'm saying that if you, as a senator, are concerned about crowding in your facilities, the politically easiest way, and in fact the most direct way, to reduce prison populations is by reducing sentencing lengths. It is much easier to change sentencing lengths as a matter of public safety. You don't have to, you could tell your constituents you're locking up the same number of people, and you could have half as many people there locked up for half as long a time.
You're saying don't tell them the truth about everything. Keep
That's
some
your
things
choice.
secret.
That's your choice. That's your choice, Senator. But in our country, as Jeremy Travis was saying earlier, we've sort of become inured to extraordinary levels of punishment for average crimes, and despite the evidence that doesn't say we gain from a public safety perspective by incarcerating people for lengthy periods for relatively routine offenses.
Before you respond to that, I want to hear from Ms. Falk, because I know in her former work she's dealt with these issues in terms of the public and what the public is going to buy and what they aren't going to buy. You agree with Mr. Lubow on that?
I want to get you reelected because we need your leadership for the reforms statewide. And so my school of hard knocks here, of being a county executive for 14 years in one of the counties in your state, Senator Davis, is when I started out 15 years ago, the first thing I faced when I was elected was a conservative county board that had just passed a resolution to add another $45 million in jail beds in our county at a cost then of about $3 million more a year to operate. Well, one of my first actions was to veto that. I had a sheriff who was very unhappy, although District Attorney Hynes did not object to that. He was a pioneer before his time. My job then, though, was to be able to convince and show, and myself and 500,000 citizens who I work for, that they would be safer by my veto, not less safe. So then the hard work began, and the two lessons that I learned that I hope are helpful to you, Senator Davis, is one, the public knows what we're doing now doesn't work. They know, and they are hungry for leadership to change what isn't working. They know that their brother-in-law has a drinking problem, and after he gets out of jail or prison, still has that drinking problem. They know this 16-year-old Latino offender got picked up not because he was doing something wrong, but because he was driving without a valid driver's license. They know the system is broke, and they want change, and they want to be safe. And so what I did locally, and what I urge you to do, Senator Davis, is to say there are a level of crimes that we're not going to talk about alternatives for. But start with those where you can go to your public and say, you will be safer by doing it this new way. And how I did it was to start methodically with looking at the 1,000 people who were on our jail on a given day and say, well, this level of offender right here, these alcohol offenders, and half of the sentenced inmates were there because of alcohol crimes. If we don't do something about their alcohol problem, they're just going to reoffend again. And what is smart about that? And so by starting small programs with small numbers, looking at the data, and then going to the public and saying, this program of treatment for alcohol offenders has made a difference. They're not reoffending. Let's take it to scale. That has earned their support, and we are now 15 years later with a small jail population today as 15 years ago, despite the fact the county grew by 100,000 people. So I urge you to take those small steps so you can show people they work, so they will be confident that not only are they safer than they were before, but it's saved a whole lot of money.
I like that. I need you. I need some help from you. I want to hear from the two folks I haven't heard from. Mr. Martin, I know you do a lot of work with reentry.
Of course, I'm sorry.
I mean, I'm assuming, and I've heard a lot about these reentry programs, people who get out and they need help because a lot of them who get out end up going back in. I mean, you think I ought to work on more reentry programs as a possible solution?
I don't think reentry programs are the solution. I think reentry programs are important because we've already incarcerated a very large number of people, and essentially 95% of those people are coming home at some point. I'd start out by saying that that you essentially have to obviously bring other folks to the table, right? Because it sounds like you're from a community that's disproportionately impacted by law enforcement, by the criminal justice system, just by the large numbers of calls you seem to be getting to your office. But you have to understand that the prisons and the folks who tend to benefit from the criminal justice system are not from your community, right? They're usually from the more rural communities, maybe the upstate communities in the state of grace. And I really think we need to bring those folks to the table. Also, I think if you have the conversation just within the criminal justice arena, then you're continuing to do what we've been doing for years, which is to silo the issue, if you will. Most of the people who end up in our criminal justice system are the products of our other failed policies. Our failed
That's why I invited Dr. Prothrow-Stith. Next time I'll invite some more of her colleagues to come too.
I think that makes a lot of sense. And I'll start out by saying that something that my good friend Marty Horn always says, the former Commissioner of Probation and Correction, which is that you're going to have an appetite for risk, even as an elected official, right? So if you're going to do something
I don't like that part, the risk part.
Yeah.
I'm trying to get reelected.
I can appreciate that. But if you're going to do big things, you have to be willing to have an appetite for risk. And by starting out the conversation by suggesting that, by asking us whether there are certain crimes where you would absolutely say no, unfortunately starts us, right where we've been for a really long time. And I would argue that, I'll give you a personal story. First of all, I'm pleased you invited me to the table, not just as a person who runs a reentry organization and who does policy advocacy work, but also as someone who did 6 years in prison before I started doing this work, and someone who lives in one of the communities that are disproportionately impacted by this issue. And my response is, I'll tell you a story about my younger brother who used drugs and sold drugs and got arrested for a weapon. Right? And he did time for a weapon. And while he was in prison, and he did something wrong, right? He got caught with a weapon and he was going to do time. In New York State, there's mandatory. With prosecutors' discretion, he ended up with less than the mandatory, but he still ended up doing time. But while he was doing time, he didn't benefit from any of the drug and alcohol treatment programs or any of those things that are sort of siloed and made for people who have drug issues. And he came home 2 years later, not that much different than when he went in. And part of it is that when you start the conversation the way we started today's conversation, that's unfortunately where you land. So think big.
Thank you. Thank you. I'll need your help too. Mr. Norquist, I really need your help because my Republican colleagues in the Senate, by the way, you know I'm a Democrat, right? I need your help convincing my Republican colleagues to implement some of these great ideas that y'all have been talking about. Can you help me with that?
Sure. Well, if you want people to take a different approach than they have in the past, you need to get them different information. You've seen all the polls. Would you like more of this, more of that, government services? And people say yes to all of it. And they say, would you pay $100 more for that? No. Unfortunately, what's happened is a lot of people have said, well, should we put this kind of criminal in prison? Yes. How about this kind? Yes. And never asking, what does it cost? And so I think one of the numbers that in the state of grace, it needs to be popularized or understood, and California costs $50,000 to keep somebody in prison for a year. When you just put that on the table, then all of a sudden, whoever you're talking to starts to think, oh, so if I want to put this sort of person in prison for using marijuana, it's going to cost $50,000 a year. And I mean, there's some people you might say $50,000 a year, it's a very good bet, let's put two in. But all of a sudden you start to look at it a little bit differently, and the person you're talking to begins in their own mind to make priorities. And I think the difference between violent criminals and nonviolent criminals and all sorts of things then come to the fore. But if it's all for free, do it all. But it's not all for free.
Senator, I came to this meeting misunderstanding something. I thought you presented a conundrum. You're broke. You've got all these people in prison, half of whom are on property crimes and drug crimes, and you don't know how to deal with the system. And I was only suggest 30 seconds. First of all, there ought to be a real effort to have early release for the drug people or people charged with drug crime and the property crime, and with a good reentry program, because I think that my good friend Glenn may have over-dramatized. Reentry is a very important part of our tool for public safety. If Professor Bruce Weston, you've heard of, said that reentry programs in Brooklyn reduce recidivism rates by more than half. But there has to be a two-pronged approach. One, get people out of prison by early release, and two, have programs for drug treatment and for reentry, which keeps the population down. You'll then have the resources that you can work for reinvestment that Jeremy Travis talks about, justice reinvestment.
And Senator, I have to say that a lot of these programs work in the context of prison, but they actually also work before prison. And if you look at the schools, you will see an opportunity to keep some of those young people from going into prison. And I would just encourage you to look at Boston's effort with street youth outreach workers. At one point, there were 120 in the city, and it reduced violent deaths to teenagers dramatically. Today, they are struggling financially as well and are down to 40 or so, and those homicides among young people started to creep back up. And I really think that the same kind of initiative that works in prison works before prison. And you kind of brought me to this table. I'm kind of a fish out of water here, but I just have to say that because the kids who wind up in prison, we know them. We're stitching them up in the emergency rooms. We're suspending them from school. They are hanging out on the streets. And as a society, that's where we really need to invest some of our money. It's difficult in this kind of situation, but that's where the leadership can come.
Well, I tell you, I hate to say this, but I got to go to do a vote. We have to meet again. I want you to come back. You've given me some great ideas. I'll be calling you back to help implement you. So thank you, and please come back to see me another time. Thanks. Give him a hand, but don't go anywhere. I want us to step out of this primarily because I don't like being called senator or anything. And just break out and try to discuss in more depth some of the issues that were raised in this discussion. And I guess I want to start with a point that Mr. Norquist made about the cost reduction strategy. I mean, this is an argument that has been made for many years, probably by many of you in this room, as advocates to try to influence policymakers and to say that, it just costs too much money to lock people up. The first question I have of the panel, and anybody can take this, did it work? Does that cost reduction strategy, that argument, really work with policymakers? I want to ask that first, and then I want us to, I'll go ahead and throw out the second question. Even if it works, is it the best strategy, or should we really be trying to change people's minds about the value or lack thereof of incarceration for certain types of crimes? And I'll throw that out for anybody. Kathleen,
yeah,
go ahead.
I can start there because I certainly came from it from a cost. The job of the county executive is to be the guardian of your money, and I'm German-Irish from Milwaukee, so it's easy to be cheap. So I started from before I spend $45 million on anything, is what we're doing now working? Because why would you spend more money doing the same thing if it's not working? So that's the purely Stanford grad, practical reaction that I came to the problem with. But second, what I quickly learned is that I, like anybody else, would pay almost anything to make sure I'm safe and my children are safe. There is no price tag to put on that. So while I came from it originally from can we do this smarter on money, I quickly learned I had to show that smarter on money actually made us safer. And then the two dovetailed, because I could say this program we created to keep alcohol offenders from reoffending means you are safer on the roads. And by the way, it means we didn't have to add more jail beds. It helped, but it wasn't convincing alone.
Okay, that's interesting. Bart, did you want to add to that?
Yeah, I've been doing this alternatives to incarceration stuff for the past 40 years, and the argument has generally not prevailed. Now, we haven't had a recession as deep as the current one, so the fiscal crises that states and localities face are much more severe, but you know, I worked for New York State government during the first Bush recession. Everybody argued, and Bob Ganges somewhere here, that we weren't going to build any more prisons because it was costing too much money, and been through this cycle many times. It's not sufficient. It's a relevant argument. It's very compelling in the current economic environment. It is made much more compelling by a number of other factors, by the fact that crime is down to historic low levels, creating the ideological space to actually have a discussion about whether our policy makes people safer or not. We have a lot more evidence about things that work and don't work. We have promising models of programs, and we have promising experiences of safe correctional population reductions, which are probably the most important examples we have, because they demonstrate that it is not just about money into new programs, but in fact a problem-solving approach that addresses issues up and down the case processing continuum.
And you can't deal with the cost factor in a vacuum. It's not important that it's cheaper to have someone in a program than it is to incarcerate them. That's an easy comparison. The important thing is you have to go to the next step, two next steps actually. The family value problem. What do you do to a family when they are riding back and forth to Rikers Island in a livery cab, trying to see their son or their brother or husband? What do you do to a family that when someone comes home from prison, there's nothing for them? So these programs have to move to the next step. You have to give people a reason not to commit crime, a reason to become taxpayers. And that's why successful reentry programs which get jobs for the formerly incarcerated, successful drug treatment programs which get jobs for recovering drug addicts are the way to go. And you can sell that to the most conservative person in your constituency.
I actually think on behalf of the children whose parents have been incarcerated, especially for some of these crimes where we know the incarceration probably made their situation worse as opposed to helping the situation, there ought to be a class action suit against the state on behalf of these kids for malpractice. I think at some point we've got to say, this doesn't make sense, and that kind of incentive will help change the public opinion and get some dollars.
Angela, you could shut me up.
It happened with mental health hospitals.
You can shut me up if you want in a minute, but just 2 weeks ago, we unveiled something called Drew House, a 2-year experiment. It took us 12 goddamn years to put it on the table because no one listened to us. Columbia University School of Nursing found incredible statistics about reoffending rates down to single digits at a cost of $34,000 to keep a mother and her kids in a safe home environment, as opposed to $129,000 to incarcerate her and put the kids in foster care, where predictably they'll commit the significant crimes of violence later on.
Can I just say something? So I think as a rhetorical device, it brings people to the table, right? You're more conservative folks, obviously, and I think we are at a tipping point with our economy where more and more people want to have this discussion about how to save money. But criminal justice policymaking is primarily driven by fear, right? Here's what's going to happen if you don't lock people up and so on. But what I found is even today, you know, at lunch when Grover was at the table talking, I said to myself, it's excellent that I'm in the space with this man who wants to have this discussion. But at the same time, I kept saying to myself, wow, he needs to learn more about that. He needs to learn more about that. Nothing personal. It's just that I feel like he's new to the conversation, and some of the things he was saying, something brought him to the table, right? Something brought the right on crime folks to the table. But I don't feel like we can continue this conversation about how we can save money, because that is not the real conversation. And I didn't mean to suggest reentry wasn't important. Reentry is extremely important. But when I walk through the neighborhood I live in, it's almost like you're waiting in the emergency room to solve cancer, right? It's important work, and it stops people from going back through the cycle. But you got to look at law enforcement practice, community policing, all those sorts of things that are feeding the system.
Public schools.
Certainly, it's got to be a multifaceted approach, no question. And I was just about to go to you, Grover, to ask you, you know, Is this cost reduction strategy the only strategy that really appeals to people on the right, or can they been persuaded by other arguments about incarceration?
No, my point was not that that's the argument. That's the piece of information that is easily checkable so that when you say it to somebody, they believe you are telling them something true because you can sort of look at these numbers, and then all of a sudden a bunch of questions flow from that. What's the benefit of putting someone in prison? Is there a benefit to keeping different people in prison? Is it more of a benefit to keep somebody who's violent in prison than somebody who's not violent? Okay, well, then how much of each of these things do you want? If you've only got so much money, you have to decide what to buy in the store. If you've only got so much money and you're going to incarcerate people, which ones do you want in prison? So it begins a conversation not just about cost, but about benefits. And that's where you get it. I would argue it's the opposite of the debate today over public education and the quality there. People didn't start with a conversation about, gee, public school costs a lot. They started with a conversation of, it's not working, it's not providing the education for kids. But not everybody, I mean, many people have kids, a much smaller segment of the population either, lives with or knows prison guards or people in prison. And so you've got a smaller group of people who have a sense that it's not working and it's way out of whack. The public school system, the people said, we need to do something to reform the DC public schools. That conversation, completely independent of how much money you're spending, it went from quality to and we're spending how much? This is not working, and it costs $14,000 a year. Oh my goodness. I think you get a conversation going with a bunch of people who don't have any connection with the prison system by saying, here's what it costs. Oh, that's not something I knew. And then you can have a conversation about what works, what doesn't work, what the benefits are, and all of the questions that you're raising then can be entered into. But look, people are busy. You can't get everybody to focus on the stuff you want to unless you give them a reason and a sense that there's something you can do about it too. I mean, if it's hopeless and it's not, then I'll go do other stuff.
I want to start to drill down to more specifics in terms of some specific programs and models as we get to the end of this discussion. But before we get there, I want to ask you more generally about the focus of criminal justice reform during the next 25 years. We hear about a lot of different ideas. Of course, we hear about alternatives to incarceration. We hear about reentry programs on the one hand. Should we focus on prevention, treatment, education, et cetera, as the doctor has talked about, or should we focus on alternatives to incarceration and reentry? I'm sure everybody here would say they're both very important. The question is, how should they be balanced? Does anybody have a sense of where we ought to start? Where should we put our focus as we move forward?
We're not Senator Davis anymore?
No.
But I would never come to a meeting without being willing to offer a suggestion, right? And this is the real world, and life is short. So what if you were still Senator Davis and we were all in that room with you? What if we said to you, if every county can look you in the eye and say, if we send one less person to the state prison system next year, would you give us half the money back the state would have otherwise spent so we can reinvest in early prevention, early childhood initiatives, and reentry programs? The state will have saved half of what they were already going to spend, and we're able to do both on the front end. Is that a deal you can take?
What do you all think about that?
This is an
Got
idea.
Some fans from the audience.
This is an idea of District Attorney Chisholm in Milwaukee County.
The criminal justice system in New York State, by the way, is appalling. Any New Yorkers here, do you know that it costs you $240,000 a year to keep a kid in detention for 1 year? Yes, $240,000. And Jeremy Travis released a report in 2009 for Governor Patterson that found significant abuses, physical, mental abuse, sometimes sexual abuse. These kids are released with no reentry. They're ticking time bombs, and they get rearrested at the rate of 78% in 3 years. It's insane. So you want to start somewhere, start with the juvenile justice system, and that's an oxymoron, because it's no more justice than the man in the moon.
I think there's a way to connect re-entry to prevention. In public health, we have the notion of primary, secondary, tertiary prevention. a lot of people incarcerated. I don't know the percentage, but my guess is it's more than half are parents, and their children, by definition, are at risk. And my guess is as you do reentry, if there are some real parenting activities and an ability to focus in on those children for preventive purposes, we could have an even greater impact. I mean, I think of something like Big Brother, Big Sister, which has a very rigorous randomized design evaluating the impact of getting a Big Brother, Big Sister on children. And within 15 months, and a lot of people think these kind of programs take a long time, the children who received a Big Brother or Big Sister were doing significantly better on many variables: school attendance, use of drugs, absenteeism, participation in extracurricular activities. And, that kind of program for the children of incarcerated parents would really begin, I think, to concentrate our resources in a way. And I haven't figured out how to get criminal justice to pay attention to non-criminals, a little bit to victims, but these children are there. If we could figure out some way to spend the money on them, and I think, Jeremy has written about the impact of those, of this massive incarceration experiment on children, I think we have an opportunity to break that cycle.
Glenn?
I think it's important that we incentivize localities to do things differently so that they're sending less people to prison and they're rewarded as a result. I started doing this work because when I left prison, I was reminded of the amazing capacity of people that are sitting in prisons in New York State, right? The people I met while I was there. I would argue that we should also consider incentivizing the folks who are doing time to do things differently, if you will, and give some thought to what that might look like, taking into account that some people have mental health issues and physical disabilities and so on. But I think you'd be pleasantly surprised that, guess what, there's a lot of people in prison that have amazing capacity to be self-motivated to change their own lives. And that's not what I saw in those 6 years I did in prison in New York State. I saw a lot of warehousing, and I saw a lot of people who were there for a lot longer than me for much less significant crimes than the one I was in for because of our mandatory minimum laws. And that's what drives me every day. So even folks on the conservative side, if you want to just be, just really selfish about it, you got to say to yourself, like, what is the loss to society of these 2.3 million people sitting in prison every day? And is there a benefit to maybe being much more nuanced about who ends up going to prison and who doesn't? Because in my own self-interest, the person who might have found a cure for cancer might be sitting in prison.
So I want to talk. I want to talk a little bit about if we're going to. There are a lot of great, fantastic ideas for reform here. But how do we implement reform, right? How do we do it? Who should be involved in the process of implementing reform in the criminal justice system? Are we talking about, I've heard talk about leadership. We need leadership from the top, leadership by prosecutors like Joe, who go out and advocate for his program and take leadership and go to his communities. I've also heard people say, we should go to the people themselves in sort of a grassroots effort. Which one of those strategies works? Is it some combination of the two? Is it something else? How do we go about implementing reform ideas in communities?
I think you have to get the community behind you. I think the community has to understand the logic to the arguments you're making about these alternatives, and then they've got to be with you, supporting you with your legislators. So it has to be a broad-based approach that has all of the stakeholders together, recognizing the benefits.
So how do you do it? You go to churches and speak? Do you call meetings? How do you get people to come to a meeting?
I do all of the above. Okay. And when I get tired, Ann Swearing goes to the rest of them.
Okay. Kathleen and then Bart.
Yeah, my reality check of world. So when I started the work 15 years ago as a county executive and began slowly looking at the segments in the jail and crafting these alternatives for these different categories, people with mental illness, people with alcohol problems, young Latino offenders, some of these programs I've described. and worked and kept building them. And I would use every opportunity to talk to the Rotary clubs around the county and anyone who would listen, so I could take my case to our public and say, here was what the problem is, here's what we've tried, here are the results, should I keep doing more? And they keep reelecting me 3 times after that. But when I came to running for Attorney General 5 years ago now, people in Dane County trusted me on crime because they saw what we were doing worked. But there was $3 million in negative TV ads elsewhere in the state that said your children would be unsafe if I was elected Attorney General. That cost me an election, and 2.2 million people voted. I lost by 7,000 votes. So the political consequences of why we're all here and what's at stake here, we know. And so my suggestion here is what we can do, all of us in this room, is not only support those leaders who are willing to be different, as you do, but as we talk about our successes, put faces on names of success. The film is a wonderful idea. Show real people who everyone else can relate to, that are just like them, but for the grace of God, would be in jail or prison. I can think of so many examples of the people in these programs we have done, but you know, the guy who stops me on the street and says, "You're Kathleen Falk, right?" "Yes." "Well, I'm really shy and I never would call you at your office or anything, but you're standing right in front of me, so I gotta tell you, if it wasn't for your drug court, I'd be dead." If we can tell those stories, real people, just like you and I, that these programs work, then that fear factor we've all talked about helps diminish.
One of the advantages is that there are 50 states and there are lots of cities and political subdivisions. We need to take examples that work, good examples, and highlight them. We've seen that in some cities that have done better on crime and different kinds of policing, and we've seen it in how people approach certain the leaders of public schools in D.C. or other states. They say, "Look at this," and other cities and states go, "Oh, that works." And I just think we ought to have more focus on successes, and not just from the standpoint of people doing better coming out of prison, but that the neighborhoods are safer, that you'll be safer because this other guy's in a better spot than he would have been if we'd locked him up. This is, you go to the general population, say it's safer, better, easier, less likely to have your car broken into because of these different approaches. And there are enough different places that are doing it different ways. That information needs to be quantified and shared.
At the end of this panel, I'm going to ask each of you to, well, not necessarily each of you, but any of you who want to give me some of those examples, specific models to share with the audience. But Bart, I believe you wanted to speak on this point.
Yeah, I wanted to suggest that I think Jeremy hit on a kernel of at least what we have learned over the past couple of decades works best to safely reduce reliance on incarceration, whether it's juveniles or adults, when he talked about approaching it not so much from a programmatic standpoint, but rather from a collaborative problem-solving standpoint. So we do this juvenile detention reform project in 40 states now in about 150 localities. Average reduction in juvenile detention across those sites is more than 40%, and the average reduction in juvenile crime has been at least 25% in those sites. The key to it is not a single program or a single change in policy, but rather a very intentional, ongoing, deliberative, and accountable effort to examine how detention's being used, to figure out where the kids are coming from, why they get stuck in the facilities, how they get out of the facilities, how that could be done better, and what strategies work best to both keep the kids out and keep the public safe. Those efforts are done by a wide variety of stakeholders, in fact, with people sort of shedding their traditional role to participate in a more deliberative exercise, including community folks who bring a totally different perspective and ask a set of questions of system stakeholders that really are refreshing and challenging and need to be part of the equation. So I think the lesson that we draw from that is There isn't a single silver bullet to any of this. There is rather a comprehensive approach to changing the way we currently do business in order to achieve aims that we can mutually agree are important to achieve.
And I think everybody would agree with that. I want to press you all, though, on the issue of specifically. I mean, if we're talking about a reform movement, I mean, how do we start? Who do we go to? We got to convince the people. We got to show leadership. Who's got to show leadership? How do they do it? Where do they go? Who are they talking to? I mean, help me.
I'm not sure how it's different than any other effort to change policy, in that if you are Senator Davis, the first thing I'm going to be thinking about is the carrot and the stick. What's going to motivate Senator Davis and what is going to scare Senator Davis? And I'm going to try to build my coalition around that. And I think that's going to differ. It's going to differ in different jurisdictions and so on. So, and the other thing is, looking for a silver bullet solution. I really appreciate everything you just said, Bart, by the way. It took us decades to get here, and it's sort of unfair to ask for a program or any sort of quick fix solution. This is going to be...
I'm not asking for quick. I'm saying in the next 25 years. And it's going to be lots of different things. I just want to get concrete ideas. I'm not asking for a bullet, believe me.
I mean, I
We
could
know
sit
that
here.
doesn't work.
I could sit here and give concrete examples of things that work, right, from my own program, and I've resisted that because I didn't want this to be a discussion about the program that we
go
run.
ahead.
But for instance, we're one of the programs that provide housing to people coming out of prison, and what we do is some very specific things that other people don't do. We target the most difficult cases. Right? So much so that parole calls us when they have the kind of case where the community is just not going to accept the person back. They know we will take that person. We prioritize people who fail in our program. Right? So if a person screws up in our program and they come back and they're ready to try again, our door is wide open to them. Our 212 people on staff, half of them are formerly incarcerated. So we have a certain cultural competency. That means that when a guy's walking down the hall cursing with his pants hanging down and throwing up gang signs, I am so not intimidated. It's not funny, right? And so there are very specific things that we do that works, and you don't see it 6 months later, unfortunately, because that person may get locked back up. He may walk out of our building, walk down to the corner, realize he doesn't have $2 in his pocket, and jump on the train and get arrested. And that's not necessarily a failure if you look at his rap sheet, and his rap sheet is full of more significant crimes.
Before you speak,
yeah.
I'm so glad you shared that, because I think everybody in this room knows that there's no silver bullet. It's going to be many, many types of reforms in many different areas in the criminal justice system, outside the criminal justice system, before and after. But one of the things we wanted to do here today is we wanted to talk about specific things that work. Not to suggest that any one thing or everything that's said up here is going to be picked up by everybody, but maybe something that's said, one program may appeal to one person out here who may go out and want to replicate it. So don't hesitate to share your stories. That's why we.
I just want to mention that Glenn is being too shy about his program.
Yes, he is.
The Fortune Society ought to be funded at a level that is beyond anyone's understanding, because it's all about public safety. That's what the Fortune Society does. It reclaims lives and increases public safety. And the ultimate will put me out of business, which is fine with me. But he runs a great program.
Deborah?
Yeah, there's not enough time to really do the public health approach to violence prevention justice in this context. And I know there are many in the room who are even new to that notion. I did bring a flyer from the Unity Project, which is funded by the Centers for Disease Control out of Oakland, California, but it is a national focus on urban context and building the community coalition that's necessary for preventing violence. And with that, you'll have some contact information. The Centers for Disease Control has a center called the Injury Prevention Center, and violence prevention is one of the divisions in that center. It's very large and federally funded. Actually, its funding is being threatened right now, so it's an interesting time. The center has been around, let's see, 83, 85. So a good, since Surgeon General Koop did his 1985 conference as violence is a public health problem. So I will encourage you to seek out some of those sources. If you're in a conversation and your local or state health official is not a part of that conversation, or your injury prevention director for the health department is not a part of that conversation, then you don't have all the resources at the table that, that you could potentially use. We call it a public health problem because it's preventable. We obviously have a much earlier focus than incarceration, but in that secondary prevention category, we see a lot of the same kids. They're in schools, they're in emergency rooms. And I would just hope, especially as I think about Jeremy's, projection into 2036, that we really take the full preventive approach, which means primary attitudes and social norms, secondary behaviors of people at risk, and tertiary, which is where the punishment side of this has a role. But without the full spectrum, it's hard to say that punishment is appropriate, because there's so many places along that way where we just miss the opportunity to invest resources in a particular kid. So I'll put these in the reception. They're one-pagers.
That would be very helpful. And you all are already doing this. At the end, if there are other sort of models from other disciplines or even models from within the criminal justice system that you haven't talked about, at the end of our discussion, I want to call on any of you who have those to please share them. But before I get to that question, I want to put the issue of race on the table. Because Senator Davis was going to ask you about this, and time ran out. So it's a huge issue, right? We know all the statistics. Jeremy's told us about them. Mark and his work over the years, by the way, he I think was, I believe, one of the first people who addressed that issue and put it on the table, and has been a leader ever since then. It's a tough question. I think everybody knows that the causes are multifaceted. Everything from, the socioeconomic reasons that cause people to offend in certain types of crimes, to, discretionary behavior by criminal justice officials in the system, et cetera. But if you had, and we could have a whole panel, obviously, on that. And a lot of what we've been talking about, obviously, affects the issue of race disparity in the criminal justice system, because our prisons and jails are so disproportionately holding people of color. But I want us to address it straight on, and just to get a thought from, everybody doesn't have to answer this, but anyone who wants to. Where do we go with that? What ideas do you have about how we address the issue of racial disparity? What's the best direction to go in? Should we have some specific sort of race-neutral type of program that will have the effect of reducing the disparity? Should we have some specific, racial policies that address it head-on? Something in between? Anybody?
I think you have to understand a few things, one of which is if you went to Clinton County, which is the northern part of New York State, you wouldn't find a person of color in the local jail. Now, you have to understand that there's a deep sociological problem that we have not dealt with as a society. We've really written it off. There's a movie with Jimmy Cagney called White Heat, and there's a scene with 1,000 prisoners. You could not find a person of color in that scene. So what we've done is we've written off a whole group of people, and they happen to be people of color. So if we're not going to do something about alternatives to prosecution and incarceration and reentry and intervention, if we're not going to do anything about that, we're never going to reduce the disparity. And we have, I'm proud to say, the most diverse prosecution staff in this country. We also have a judiciary in Brooklyn that's very, very diverse. And still we have, if you come to my reentry program any Friday at 1:30, you'll walk away depressed. 98% of our people are African American. And something has to be done about reducing the level of incarceration by common sense programs that have been validated and do reduce the level of incarceration.
Bart?
You know, the juvenile justice system, ironically, because it doesn't often provide us with a lot of fodder for these discussions, does in this instance simply because back over 20 years ago, the main federal legislation regarding juvenile justice was amended to, in fact, require states to address why kids of color are disproportionately in the system, and especially why they are in the system's detention centers and correctional facilities. And the sad thing to report about that is that that federal mandate did not translate into progress, translated into a lot of studies that essentially affirmed what you would have known if you walked through detention centers and correctional facilities. But Angela, you asked the question, do we need some kind of race-neutral context or approach to this? I think the opposite. So in the project that I was talking about, where we work with jurisdictions all around the country to reduce reliance on detention for juveniles, this has been a prominent and, in fact, one of the core objectives of the work. And the approach that we've taken has not been to sort of low-key it, but rather to elevate it by looking at all of the core strategies for safely reducing reliance on detention through the lens of racial equity. So everything that sites do, from who they bring into the collaborative, who the composition of their workforce is, whether they can disaggregate data at all points, at all decision points by race and ethnicity, whether or not so-called objective screening instruments in fact contain unintended bias because of the variables that are used in them. All of those things are front and center. And what our experience is that absent that kind of intentionality, that in fact the system's status quo never gets shaken or moved. So I would argue the only way to address this is to be explicit about it. We just put out a report last week, essentially said the same things that Joe said about the New York State report about youth corrections, which is it's a fundamentally broken system. The reality is citizens in this country would not stand for that system if the kids who were in it were predominantly white middle-class kids. And if we continue to not acknowledge who these systems are addressing and confining, then we will in fact remove one of the strongest arguments that we have for raising consciousness and political will to do something about it.
And that same is true for public schools. If we had a different group of kids in the public schools, we'd have a different approach to them. The criminal justice system has had such a huge impact on the public schools that I would hope that as we move toward thinking about taking alternatives to incarceration and punishment to scale in the criminal justice system, there would be advocates here who would take that to the school system now, because right now the school system mirrors the punishment and the practices of the criminal justice system. So I think that same thing is true about schools, and that's where race and class intersect in a way that you can only say shame on us as a society.
Kathleen?
My county of 500,000 people is about 10% African American and Latino, and yet they represent about half of the jail population. So I am a poster child demonstration of what's wrong with the system. If you asked our police chief, who happens to be African American, or our judges, who some are African American, whether they thought the system was biased, I believe if they were standing here, they would say they don't think so. They can't point to any one specific source of discrimination. As you said, it is a multitude of reasons. My hope was that by this work we were doing, we could help fix that problem. I don't think that was the case. And so one of the others that we took was, I commissioned about 6 years ago a review of our criminal justice system to see if there were more specific places silver bullets we could hone in on, and subtle little things that made a profound difference. Like if you were less likely to get bail because of your impecuniousness, you were more likely to be in jail for a longer period of time. Duh. light bulb went on to me. So we were able to speed up processes that didn't, on its face, look like they had anything to do with discrimination, but had profound impacts on who was sitting in our jail. It still was not enough. So armed with this enormous frustration and a political constituency who really does not like these statistics either, but with no better ideas of our own, we asked Mark Maurer to come to town. And he did.
And he saved the day, as he always does.
And he gave us a whole nother list of things we ought to be doing, and hence how I met him and why I'm here today. But we have a long ways to go in my county.
I think obviously race plays out in terms of who ends up in the system, but race also plays out within the system, even all the way up to the point of prison. If you look at who gets the great jobs in prison, it tends to look just like society, to be quite honest. So I think we need to look throughout the system. The one thing I'll say is, at the Fortune Society, I kind of look at the agency as a bit of a microcosm for the rest of the world. We always talk about Fortune Society being the way we want the rest of the world to be. And having half our staff be formerly incarcerated, just by virtue of that, it means that the majority of our staff end up being people of color, people who represent our constituency population, people from the same class level, if you will, also. And our board is also 1/3 formerly incarcerated. And it means that, and I'm saying that to say that when we have these discussions, we have to do more to include people of color, people who come from these communities in the discussion at the policy-making level, right? I mean, I'm lucky enough to be in a lot of these rooms these days, and it's not enough. It's not enough to just have 1 or 2 people of color in the room. I mean, and you have to have them there in an extremely meaningful way and listen closely to what they're saying. It's not that they're any smarter, or that someone who's never been incarcerated, or that a person who's not a person of color doesn't bring value to the table. It's just that there's a certain cultural competency that people bring to the table that needs to be listened to, and it helps to see whether or not you're passing the laugh test. Sometimes I hear things in a room, and I think of the community I live in, Harlem, and I say, that's not going to work. I kind of laugh, and then I become a bit of an agitator in the room, and it's okay. People end up feeling uncomfortable, but I think it's important. It makes me feel uncomfortable, but I think it's important for me to put myself in those situations where even I'm uncomfortable. So I think doing more to include people who are directly affected by these issues and who know these issues on an intimate level, on the policy-making level, is important.
Robert?
Yeah, we've been heading down the wrong road for a while, and mistakes have been made and lives have been damaged. And to back up, it's very difficult for an elected official to begin to back up, because then they're open to, well, you want to change things. Therefore, you've done something wrong. Therefore, all these lives that have been damaged are your responsibility. Well, then I won't do anything because I don't need that. So we need some sort of safety on both sides. I don't know that there are 2 sides, but on all sides of this issue, for people to back up and not feel that to say, okay, we've been doing things wrong, we're going to go back and do things differently, that you don't bring the weight of the world on your head. I was testifying when we were doing the discussion about crack cocaine versus powder cocaine. And you watch the Republicans on one side, the Democrats on the other, and each one wanted to know that they wanted to get the disparity down, but nobody wanted to be the guy who got hit by the other team. And the Democrats are saying, now don't be saying the Black Caucus thought this up. And the Republicans are saying, well, don't be saying this is a racial thing that we're fixing because it was your idea. And everybody's kicking each other under the table. And okay, forget how we got here for a moment. Where do we want to go? And they did. Okay, and then they moved forward. And what I always thought was amazing was that was a unanimous vote in the House, because it was unanimous consent. Any one guy could have stood up and decided to be on CNN that night by being a jerk, and they didn't.
So I'm going to turn to the audience in just a minute. You all have put a lot of tremendous ideas on the table, but perhaps there's something else you want to share, some model from outside the criminal justice system.
I think the proverbial elephant in the room is the political consideration.
Well, let me finish my
And
question first,
I just want to make the point.
Before you
I want to make the
answering.
point that I get the
Elephant?
support of the Conservative Party, and the Worker Family Party every time I run for re-election. So, it's people who run for office have got to understand their constituency is not stupid. And if you're able to explain to conservatives in Brooklyn that your programs make sense, and explain to the Worker Family Party your programs make sense, and have them both agree with you, then I think you've gone a far way, a distance of a way to make people understand that elected officials ought to have the courage of their convictions and make their argument to their constituency, or they shouldn't run.
Okay. So models from other disciplines that we can learn lessons from, or models from within the criminal justice system that have not yet been mentioned. Anything else the panel wants to share? Glenn?
I'll be
And-
brief.
and
Only-
Deborah?
Yeah,
Either
only,
one can go.
I'll be brief. Only that while we sort of work to fix the dam, we need to stop the flow of water, right? And criminal justice policy, as I said earlier, is sort of usually made very reactionary. Something happens in the news. A person works for a nursing home, they hurt someone, you find out they had a record, suddenly you can't work in a nursing home if you have a felony for 15 years. And it sounds, I mean, who's not going to back that, right? What elected official is not going to say, oh yeah, I support that, right? They're worried about their political hide. But at the same time, there's no evidence that, there's people who work in nursing homes who do nothing but cut up carrots in the kitchen, right? Or drive, the car from one facility to the other, or do the laundry and those sorts of things. So we end up with this overly stringent policy that bars people from things that's very, or enhancements. The idea that you get 5 more years if you commit an assault and the person's over 70. I hate to say it, but when I was ripping and running in the street, I didn't know that. I wouldn't have known that you just added 5 more years for doing a certain crime. So I'm not convinced that those things prevent people from committing crime. So if we could have a policy, and I think Washington State is that does this, where every time you introduce a bill, you have to talk about the financial impact of the bill. And I think other states have done it around race and so on. So I think just to sort of slow down the tide of these enhancements and these collateral consequences, you want to think about that.
The Ceasefire Project in Chicago has an element where staff they call interrupters go out and interrupt the cycle of violence, talking with those who have been victimized by violence to decrease their interest in revenge, to increase their understanding of what revenge would mean. There were similar projects, but this one has an evaluation component and is more than promising. The rates are down, so that's one. Another published in the American Journal of Preventive Medicine is school-based education on violence prevention for kids on average, and this was an aggregate of 40 or so programs. On average, there was a 15% reduction in fighting in those schools that had what was called a universal education, meaning it's not for the bad kids in a separate room, but it really dealt with the culture and the climate of the whole school, and those programs that were for the whole school, all the 4th graders, for instance, showed that kind of statistically significant reduction. And then another one is the Child Witness to Violence Project at Boston Medical Center, run by Betsy Groves, where they have been aware for a while that 10% of the children by the age of 6 has witnessed a significant episode of violence as reported by the caretakers, so it may be an underrepresentation. But that means in the 1st grade in Boston, you're looking at 2 or 3 kids who've seen a gunshot wound or a stab wound or a major fight where the ambulance had to be called. And the impact of that trauma and what it means to try to deal with it, talk about fear and what those kids have to manage. And they have been successfully treating children. So those are some projects that come to mind.
Thank you for sharing those. Kathleen?
Well, we got to be harbingers of hope here, right? This room full of leaders. And that helps inspire people to know we can solve these problems. And so one area that I have hope in is that there is a nexus here between public health and the criminal justice system. Because again, if you look at the statistics, if a fifth of our jails and prisons are filled with people with mental illness, and another 50 to 70% are there because of drug or alcohol addictions, boy, talk about, aren't those public health issues? Isn't that how we should be approaching this? And so I think there's a hope that if we can continue to educate people about the commonality of these illnesses that cause crime, we may be able to win over the hearts and minds of people. it's an approach I have taken in my county, which you're tired of hearing about by now.
No, we're
But,
not.
you know, I come from the state of the alcohol industry. It is Wisconsin. And there's a reason that the next World Series champions are called the Brewers. And so we are the state that put alcohol on the map. And so we have a big alcohol problem. You're 4 times more likely to be killed by a drunk driver than by a gun in my county. And so taking on that sacred cow has been really important if I'm going to improve public safety in our county. So how we created, there's about 13 programs that we have created and love to give copies to anybody that ever wants them, come and see me. But one of them is on this big group of alcohol offenders. And so I started by my normal homework, which is if somebody else has done something smarter, I'm going to steal that idea. So started doing the national research, and lo and behold, there was another county in Wisconsin, Racine County, where the sheriff there was so tired of seeing the same drunks in every night. He knew their family names, he knew their kids, he knew, et cetera, that he decided to do something smarter and created a treatment model where you had a month in jail and then 6 to 9 months of treatment. And it was working there. So I took our sheriff and our district attorney and some of our judges down there to see it at firsthand, and came back, and we tweaked that model and began it 6 years ago, and now we are very pleased that there's about 50 inmates in it on any given day, and 6 years later there's a 70% success rate with preventing recidivism, which is darn good in the alcohol recidivism world. So I'm hoping that future of this public health perspective on it may give us some reason for hope here.
Thank you. Grover?
Yeah, some issues, you know, one judge can do something, one police chief can do something and make a difference. At the legislative level, you really need to get a whole bunch of guys together. And I think and some
And
issues
women.
can be decided.
Guys and women.
Pardon?
Guys and women. Oh, by guys you mean men and women.
Yes, what'd I say?
You said guys. I'm giving you a hard time.
Guys is gender neutral.
Oh, I didn't know that. I stand corrected.
Okay. We aren't going to get into the shocking shortage of women in prison. Okay. The lack of crystal meth availability in urban areas. But at legislative level, you really do need on something like this, I think, a bipartisan effort, which is where left-right efforts, which have happened in civil liberties and some other issues in D.C. and at the state level, because you need some coverage, because this is where things go wrong, or when things go right, people are dead and people are hurt and so on. So as you're trying to move through legislation, there's incredible dangers that, you know, some TV ad gets made against candidates and so on. So you really do need left-right coalitions, and that takes time because people have to get some sense that they're not being walked down an alley to be politically mugged, and that they can feel comfortable. And getting those things going at the legislative level, it happens in D.C., did on the cocaine issue, but it's also happening now in Texas, Florida, and some others on crime issues, reentry issues, and so on.
So now I want to invite you all, if you have questions, to come up to either one of those microphones. Keep your questions brief, please. We have about 15 minutes for questions. We may not get to everybody, but why don't we start here? And if you can just identify yourself before you ask your question, if you don't mind.
I don't mind. I'm Jesse Lava. I'm from Brave New Films, and we're taking on the mass incarceration issue.
Oh, but let me interrupt you. Can we please thank Grover Norquist had to leave early for another meeting. Thank you, Grover, for being part of our panel. Thank you so much.
He gave me permission to answer for him.
I'm sorry?
He gave me permission to answer for him.
That was generous. I'm sorry for interrupting you. Please go ahead.
My name is Jesse Lava, and I'm from Brave New Films, based in Los Angeles. We do films and short videos on social justice issues, and we're now taking on the mass incarceration issue. So my question for you folks, I was going to say guys, and I made it folks, was about urgency and salience. So this is an issue where even among the progressive base, where they might agree with us, if you ask them to list 10 issues important to them, this probably doesn't make the list. And you might be able to persuade conservatives and moderates of this using right messaging and poll-tested blah, 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 but that doesn't mean that there's going to be the political urgency to make something happen. So do you folks have suggestions on increasing the salience of this issue and the urgency to make something happen?
Anybody want to take that one? Deborah?
One that is emerging is the use of survivors of violence on the order of Mothers Against Drunk Driving. And there have been a couple of national organizations. None has had the real presence or structure or funding or, sustainability. But for the testifying and the storytelling, those survivors, parents who've experienced the murder of a child, those are people who can tell when they become dedicated to prevention. And on the incarceration side of things, they have been used more effectively than the prevention side of things. And we've been working with one group for over a decade now. It's not there yet, but I think what Mothers Against Drunk Driving did for sentencing, for treatment, for public awareness, that group could do for this issue of prevention versus incarceration. So somehow investing in a group of informed and active and organized survivors might help us with this.
Lynn, did you want to give
I want to respond to his question also.
Okay.
I think that as criminal justice advocates, we sometimes assume that everyone's hearing our message the same way, right? I think there's tons of information out there, right? And most of the folks in this room know it. I don't think the average person, the average public, Joe Public, knows this stuff. I think they know what they hear on the evening news, right? And if it bleeds, it leads. So that's what makes the evening news. If I had my druthers and I had enough money to do what I wanted to do, I would rent every single billboard in Times Square and put these statistics that are in here on those billboards to generate dialogue. I think it has to be dialogue between the average Joe Public saying, wait a minute, I just didn't know this. And it might sound overly simplistic the way I'm explaining it, but I really think that's a huge part of it. When I first got to the Fortune Society, I partnered with the Department of Correction when Marty was there as the commissioner, Martin Horn. And what we did was we plastered half the buses in New York City with signage that talked about reentry and the fact that you can pick up the phone and call 311. And we also put a billboard in Midtown that said, you think prison was tough? Try finding a job once you get out. And I can't tell you what the dialogue was like just from, I mean, it was expensive to do as a nonprofit, but it was just worth it, and I'd do it 1,000,000 times over.
And I would ask for some space on the billboard, and I would say to the people of New York City, in 1990, 1 out of every 14 of you was the victim of violent crime. And today it's 1 out of every 85. People have got to be convinced that these programs are about public safety.
I would just add one more point about how do you create urgency or whatever, and I think you've seen a lot of indications of it today. The truth of the matter is that leadership can make a huge difference in terms of this issue and what people are or aren't willing to do. You know, if there wasn't Joe Hynes in Brooklyn, we wouldn't be having the same conversation. And other people on this panel represent the same thing. So part of what needs to happen is in individual jurisdictions and individual states, we need to find who are the champions around these issues and help lift them up and give their leadership real voice.
Yes, sir.
Thank you. My name's Michael Green. I've been involved in issues around youth violence and juvenile justice for as long as Bart has been. One brief comment. I think as advocates, we have to be very careful about throwing around the amount of money we save for a person who's incarcerated. We don't save $55,000 or $240,000 for each person who doesn't go to jail or prison. We only do that when you close a wing, or when you close a prison or jail, or when overcrowding results in building more prisons. So I think as advocates we have to be very careful not to give simplistic answers to this cost question. Now, my question, in my reading of what Jeremy said, what was embedded in just about everything he said was a shift over the next 25 years from a retributive model of justice to a restorative model of justice. And I want to commend Joe Hynes for supporting one of my favorite programs, most difficult one, called Common Justice, which is a restorative justice program for young adults that takes very serious cases, which is a real shift in how we use restorative justice. So my question to all of you is...
But not all of you will be able to answer it,
Right.
unfortunately.
Well, to any one of you who wants to respond, since we're focusing over the next 25 years, how do we begin to make that shift from a retributive model or culture of justice to a restorative model of justice? Thank you.
Does any one person want
You're
to?
not supposed to announce my program, this is on quiet right now, we're experimenting. But the bottom line is, as I've told Danielle Serid, is that we've got to get the victims together. The victims have got to be in a venue to say, you know what, it was a horrible experience, and this has been a great experience for me. I'm glad this young man didn't go to prison. Until we get to that point, people will think that my engaging in common justice makes me crazy, And by the way, to get back to the $240,000, I know what you're saying. I just want to make people outraged that we're spending this kind of goddamn money for a detention system that doesn't work. Thank you for outing me, by the way.
Yes, sir.
My name is Charlie Sullivan, and I co-direct an organization called CURE. CURE started in Texas, and so maybe my comment comes out of my Texas roots. I think we're doing a very good job on showing alternatives in regard to cost. I think we're showing in regard to rehabilitation. But I think in the next 25 years, or even now, we ought to start showing the punitive side of alternatives. I think we should begin, and I always say this, that I think we ought to call them alternative punishments. I think we ought to start talking about people having things on their ankles, being grounded on the weekends, showing that people want people to be punished. And I don't blame them. And when people do wrong, they should be punished. It's not like the district attorney said, it's the degree. That's what we're talking about. People can be punished. But alternatives, we've been throwing it around. I just heard the word punishment, maybe used once or twice during the whole panel. And alternatives, we just throw them out. We're trying to sell something in lieu of something else. Well, we have got to get our message out. And people want, it's not just like Glenn said about fear. What's driving our policy, particularly in middle America, when you get right down to it, they want punishment. And these alternatives are punishment. And we ought to show them as much as possible, and maybe a focus group. Use the term alternatives and then use the term alternative punishments and see what people think. I think they would support alternative punishments a lot more than they would alternatives.
That's an interesting strategy. Anybody want to respond to that idea?
I'll respond. Charlie, I like you, right? And I want to continue to work on the higher education stuff that we're doing together. But I invite you to visit Fortune and come see our alternative to incarceration programs that have been running for about 3 decades. Our clients know that they're facing punishment if they screw up in those programs. And we actually say the opposite to them when they come in. We say, you have a choice, right? So we see 3,000 people per year. About 600 are mandated through these alternative to incarceration programs. But when they walk through the door, we deliberately say to them, you still have a choice. You do not have to sit here. You do not have to participate. You can decide to get up and deal with the sanction that the court is willing to give you. Because these folks expect that. They expect us to say, if you don't sit in that seat, we're going to tell the judge what's going on. But they're used to that. That's what they've gotten all their lives. And when you use that stick approach, what we found at the Fortune Society is that it doesn't work. And I understand you're from Texas.
You're saying something different, though, right?
I'm not talking about your
Them.
clients. I'm
Right.
talking about middle America.
Right.
And we're trying to bring back the Pell Grants. And that's one of the things.
But don't you
Glenn,
play
and I
into the
working on.
dialogue?
A lot of that was because they felt that they were getting a free ride. They were going to prison, correctional officers, children were not able to, they're not being punished. That's all I'm saying, is trying to reach middle America. That's our problem. I think the district attorney has been able to do that.
But I would argue that middle
But New
America.
York is not Texas.
I would argue that middle America has been sold a bill of goods that's not accurate, right? And that we need to switch the dialogue. And that if you play into the existing dialogue, you continue to go down the road that you've been going down. And I agree. I know that that's where folks are right now, but I think we just need to change the dialogue.
That's a very interesting debate that I wish we had had time to get into more on the panel. Yes.
Hi, I'm Leah Gaskin Fitzhugh. I'm president of Payne Theological Seminary, where we are pleased to work with the Sentencing Project on dealing with incarceration as a necessary part of theological education. My question today, really, I think, Mr. Martin, you started it, and I think I might want to see if I can connect to it, because Mr. Travis mentioned that the need for balance and talked about incarceration as being the stain on our national consciousness. And I want to raise the question, if there are not some deeper issues related to some of the systemic problems that we're dealing with. And one, if it's not the stain of white supremacy in this country, in which, as a country, the stain on our psyche, the way we treated the Native Americans, the way we treated African Americans, that Ku Klux Klan would follow Reconstruction, that bullwhips and dogs were tools of civil rights. Our addiction to the death sentence, I mean, there's something about our psyche as a people that seeks this extremely punitive reaction to errors of human behavior, errors at different levels, however, because Ms. Falk, you talked about the commonality of disease. We miss the commonality of our humanity. And I'm really concerned at some point, where's the balance that we're made to look at ourselves as a nation, as a people, 5% of the population, 25% of the incarceration? That's the criminality of it all. And yet, the way we focus, we're focusing on them and their behavior. We're not giving attention to us. What is it about us that we produce this kind of behavior, this kind of nation, and yet we worry about, you know, the fact, I won't touch it, just let me say. I think somehow we have to move past this fear. Mr. Martin, you raised the question of fear, whether it's fear, greed, what is it? Guilt of not wanting to deal with race. You know, you're in a country where we're witnessing the fact that there are people who are ready to see a president fail because he's black, and you don't want to deal with issues of race. So it doesn't really make sense. There's a quiet insanity operating in our dysfunctionality and psyche as a people. And I'm just wondering, at what point do we break that open? Because until we do, we'll just have problems and we'll have programs, but we won't have permanent solutions. I'm concerned about that.
Thank you for that. I'm not even sure we need to respond to that. Thank you for those comments. Yes, go ahead.
Hi, my name is Emily Harris, and I run a coalition in California called Californians United for a Responsible Budget. And we are working to reduce the number of people in prison and the number of prisons in the state, and responding a lot to the Supreme Court ruling recently to reduce overcrowding in our state. And a conversation that we're having a lot in our state is this idea of as we're looking at alternatives and bringing home certain groups of people or preventing certain groups of people from going to prison, and a focus being a lot on low-level, nonviolent, unserious offenders, and then a concern that we might be reinforcing the need to incarcerate other populations that are more serious or more deserving of imprisonment, and that's a concern that, like, if we're looking at this 25-year perspective, that we're actually reinforcing imprisonment as a as something that is working for some groups when that isn't our goal, right? Our goal is actually that it's not working for anybody. And I was just curious if you all have thoughts about that in terms of how we can make sure we're making this conversation about all people in prison.
Good question. Anybody want to tackle that one? Go ahead, Glenn.
Two things. One, so I'm as a person who did time in prison, I'm not a prison abolitionist. I actually do believe there are certain people who need to do time in prison. There are people who I don't want getting off the subway the same time my mother gets off the subway, right? That's just reality for me and the communities I grew up in and so on, and some of the people I've met in prison. Having said that, what we do at the Fortune Society is to be very conscious of what we call net widening. The idea of pulling people into our alternative to incarceration programs who might not be facing time in prison to begin with, but then who suddenly fail in our program and are facing time in prison. And so for us, as we do all of this reentry work, helping people come out on the back end, like we very deliberately are an advocacy organization that's always advocating for diversion programs where it's appropriate. And part of that is even in our alternatives to incarceration program. So we go into the courts and work with the prosecutor's office and work with the judge and work with the defense attorney to make the case for people being better served in the community. And it's not the cases you would think. It really is like the most difficult cases. And you know, someone outed you around common justice, but I think actually common justice is going to be the standard for everyone who's doing alternative to incarceration work. And God bless you for being willing to take the chance on some of those young guys who have committed very serious crimes, but where Danielle has brought the victim into the conversation and said, you know what, the victim is not best served by this person going to prison, and we can do something differently and come up with better outcomes. And it doesn't, well, I won't say what's happening, so that's the most I'll say, Joe. But it's amazing, and you're a hero for doing it, Joe. But I agree with you that if we go down the road of, I mean, even calling it alternative to incarceration, there's an assumption even in that language, right, that incarceration is the first choice and we need to find an alternative. And I think we need to just flip that paradigm on its head, and a big part of it is just re-incentivizing the entire system.
What I found amazing in the California decision, because it was written by a judge whom I have great respect for, Judge Kennedy, is that releasing 30,000 people, knowing, or someone should know, that 6 out of 10 will get rearrested within 3 years without having a reentry program, was just mind-boggling to me.
Yes, sir. Last question.
I'm Don Murray with the National Association of Counties. And County Executive Falk, I really enjoyed your comments about early childhood development. Because, I mean, here is such a critical period, prenatal to 3, where 85% of the brain is developed, and where many kids are not properly nurtured. And it stays with them as they get older. I always wondered, how could someone take a gun and blow someone's head off? And then I read David Hamburg's book on children, Today's Children, where he argues that if a kid is not properly nurtured, although he did talk about extreme examples where a kid would go into a closet, an abused child, and come out permanently blind. But he felt that it's almost over by age 3 without proper nurturing or severe lack of nurturing. And yet, as a nation, we do so little in this area. Janet Reno used to put it in every speech she made. She talked about the development of conscience. I think she felt that what she had read, that it occurred at age 2. So I'd like to get your reaction, Dr. Stith, at Harvard in public health. I know you have an early childhood program that works out of Harvard. And County Executive, what did you have in mind in how we can spread the importance of early childhood, like county nurses that go out and teach parents how to, and finally, to Dr. to Attorney General Hynes, what can we do?
I lost that race, by the way, twice.
What can we do to bring back Ebbets Field?
I'm going to ask you all to really briefly respond. I think you have already perhaps answered.
I would just say that early childhood is extremely important, and use this as a way to say that even if you're doing tertiary prevention and you're at that end of the spectrum, think about pregnancy and parenting, because there is a way to interweave what is true prevention for people who are at very high risk. Fortunately, there are ways at much older ages that children are able to be nurtured and incorporated into a healthy adulthood. But if you want to get the largest impact for your dollar, early childhood is a good place to put some money.
Yeah, we know it works. You know, this is not rocket science. The stuff we're talking about this afternoon is rocket science, but early childhood is not. And so 8 years ago, I wake up on New Year's Day, not with a hangover, but my New Year's commitment is the fact that 20,000 kids in my county are still living below the poverty line, and got to do better. Just got to do better. So again, pulled a smart group of people together who think about this a lot. Didn't want to reinvent the wheel, want to steal somebody's idea anywhere in the world. And we did a homework process where we came up with a pilot that we took into the poorest neighborhood in Dane County, where we are wraparound services. That's not new. But what we did is a job component. So it was a home visitation nursing model, but we're the government, we're not here just to help you, but we want to help you realize your hopes and dreams for your children, and that means you need to work. And so it was a wraparound home visitation model with a work component. And we are now 8 years later, hundreds of families different. This is not rocket science. And the difference it made in prenatal care, in kids those first 3 years getting all the healthy start they need is obvious. The difference it made in postpartum depression, addiction for moms, no, of course. What we didn't expect is the impact on the whole community. Yeah. To see people succeeding who weren't succeeding in the past, and what that did to the teenagers and the men who were mostly absent from the families was really powerful.
I want to thank everybody in this room for coming out today, for sharing this day with us, this celebration with us, for listening to the panel. I hope that you all got as much out of it as I did. Before we move next door to the reception, please join me in thanking this magnificent panel for a great discussion.